Hey folks, Nick the nurse here. Today we're going to be talking about some of the things that happen when a patient is suspected of having a myocardial infarction or a classic heart attack. So when the patient presents to the ER or even makes their way to a telemetry floor, there are several diagnostic tests that the physician or provider might order in order to get a handle on what's going on with the patient and how we can get them where they need to be in terms of returning them to their baseline health. One of those things that physicians and providers like to know about, and telenurses know a lot about this, are drawing cardiac enzymes. And there's a lot of different cardiac enzymes that physicians and providers can order, such as troponin, CKMB, there's just a lot, LDH, there's a lot of different cardiac enzymes that physicians can order. And you as an astute nursing student and eventually as a nurse are going to need to know the difference between those different cardiac enzymes as well as some of the different levels for those cardiac enzymes, because they're game on nursing school exams and they're definitely testable on the NCLEX RN and the NCLEX VN or PN exam. So make sure that you know those and that you understand them well. There are other lab results or lab tests that physicians or providers might order as well, but they don't necessarily measure or determine whether or not a patient had a heart attack. For example, a patient might present with chest pain of a particular type, and the physician might order a D-dimer exam. Now, a D-dimer exam is a lab test that will generally determine if a patient has a pulmonary embolism, for example. Or they might order a PT-INR on a patient to see how thick their blood is, which can certainly put them at risk of developing a heart attack or a classic myocardial infarction. So a lot of lab tests that are really important when addressing or providing assessment or interventions for a patient who is suspected or does have a myocardial infarction. And obviously, we would want the patient to be on continuous telemetry as ordered by the physician. So a lot to remember. Again, I'm Nick the nurse. I'd like to thank you for watching this video today. If you'd like to check out any of my other completely free videos, they're all at www.nickthenurse.com. Again, that's www.nickthenurse.com. Or feel free to subscribe to my absolutely free YouTube channel, Nick the Nurse. Thanks for watching. I'll see you next time.